Okay, good afternoon, everyone. I'd like to welcome everyone, both in the room as well as on the phone and on webinar, to our Sci-Fi Ontario seminar series that Sci-Fi hosts in partnership with Public Health Ontario. I'm happy to be your moderator today. My name is Raymond Ramdale. I'm the president of the Canadian Institute of Public Health Inspectors Ontario branch. I would like to let all the participants know that are currently on the webinar that we will remain in lecture mode for the duration of the call. If you have any questions, please send them through the chat pod, and that's located in the bottom right of your screen. This month's topic for our Sci-Fi Ontario seminar series is generating and interpreting environmental monitoring data. It is always a personal thrill on my part to have the opportunity to introduce individuals who I know, and I am going to do so now. These are two bright minds that are very well versed and knowledgeable on the topic, and I'm very happy to have them here. Sunil Varghese is an environmental health analyst in the Environmental and Occupational Health team at Public Health Ontario. Previously, he worked as an occupational hygienist at the Workplace Safety and Insurance Board of Ontario and at the Pan American Health Organization in Guyana, South America. He holds a Master's of Science in Occupational and Environmental Hygiene from the University of British Columbia. His current research activities include indoor air quality, surveys at ice arenas, and community radio frequency surveys. We also have with us James Johnson. James is an environmental health analyst at Public Health Ontario and a registered occupational hygienist. He has worked with the Environmental and Occupational Health team for over 5 years. When not working on exposure-related requests, he is interested in using technology to make public health and environmental data more accessible and visual. Without further ado, I would ask that you please join me in a warm welcome to our two speakers today.
Thanks, Raymond. So we're going to be talking about generating and interpreting environmental monitoring data. So we don't have any conflicts to declare. And so for learning objectives, by the end of the webinar, you should be able to describe the basic elements of occupational and environmental hygiene. So these include anticipation, recognition, evaluation, and control. You should know how to access the EOH Instrument Loan Program, explain how sampling can be used to address exposure questions and some of the strengths and weaknesses of different sampling methods. As well, describe some examples where sampling equipment may help with hazard investigations in community settings. So James and I are occupational hygienists. What is occupational and environmental hygiene? Hygiene is defined as a set of practices performed for the preservation of health and prevention of disease. Occupational and environmental hygiene involves following the anticipation, recognition, evaluation, and control of chemical, physical, and biological hazards in the workplace and community settings. So anticipation, this is our first step in an occupational environmental hygiene investigation. It's often conducted by the health unit by identifying concerns raised by the public. It involves identifying a potential problem before it occurs and can include identifying new sources or facilities that may discharge pollutants to the environment and result in exposure to people in the community. Recognition is our second step. So this involves identifying potential chemical, physical, or biological hazards and the setting or scenario where exposure might occur. Literature searches can be undertaken to see if the given scenario has been evaluated previously. Field visits may also be useful for assessing the potential for exposure. Evaluation is our next step, and evaluation of a recognized health hazard requires measurement or estimation of exposure levels. It involves identification of a sampling method that is sensitive enough to detect the specific chemical, physical, or biological hazard at levels of interest in either a workplace or community setting. Once measurements are taken, they can be interpreted by comparison to standards or guidelines intended to protect human health or used as the basis for estimated exposure and a risk assessment. There might be some situations where taking measurements may not help with resolving the issue. There are scenarios that don't have standards or guidelines for comparison. And in these cases, the scope of the project may differ from those scenarios where established standards or guidelines are present. So control is our final step, and control measures should be implemented if the chemical, physical, or biological agent has been measured at levels that could impact human health. And selection of an ideal control method takes into account many practical aspects, such as whether the control is likely to reduce exposures to an acceptable level, and whether it is realistic to have a given control in place. In some instances, we might conduct follow-up measurements to confirm that the control is working. And on the EOH team, we're able to provide guidance with all of these steps and work with the health unit on all of these steps in conducting an occupational and environmental hygiene investigation. So there's also a concept of hierarchy of hazard controls, and this involves our preferred way about going about controls. And so elimination involves eliminating the process or material, or eliminating the process that's causing the hazard. And so this eliminates the exposure altogether. Substitution would involve substituting a hazardous exposure with some other process that is less hazardous. Engineering controls would involve things such as ventilation to reduce exposure. They could involve wet spraying for dust suppression. And for administration, these usually revolve around timing and of operations. And so one example might be mining activities and blasting operations, and that they're timed at in certain parts of the day so that they're less disruptive to the community. We wouldn't want blasting to be going on at nighttime where it might disrupt people's sleep. And personal protective equipment, so PPE, that stands for personal protective equipment, and this involves things such as, in the workplace, this involves things such as respirators, things that you can do to reduce your exposure that somebody could put on. And this is the least ideal control in a workplace, and it's not really feasible in a community setting to ask everyone in the community to wear respirators if dust levels happen to be elevated. And so I'm going to talk for a moment about the Instrument Loan Program. So the Environmental Occupational Health team at PHO is able to provide support to health units in conducting an occupational and environmental hygiene investigation. The EOH's occupational hygienist can provide advice in addressing exposure-related complaints, guidance on conducting measurements, training on the use of instruments, and assistance with the interpretation of results and loaning of environmental monitoring equipment. So how does this work? Well, typically, health unit staff will call or email us asking for assistance with a scenario. We will then ask for more details about the situation or ask the health unit to conduct a field visit looking for specific information. If measurements are helpful for the given scenario, instruments for conducting measurements are narrowed down and training on the use of appropriate instruments is provided. Guidance is provided on conducting meaningful measurements. Post-measurement, assistance with analysis of the monitoring data interpretation is provided. And in some instances, we presented results at community meetings where there's a high level of interest. So I'm going to be passing it on to James.
Okay, thanks to Sunil for introducing some of those concepts about hygiene, and then also some introduction to how the Instrument Loan Program works. I will be speaking about some of the instruments, but before I do that, I wanted to provide some background in terms of the occupational hygienist logic and how we're sort of thinking about exposure and some of the steps that we're doing. And so naturally, when you're in a community setting, that control step that Sunil referred to isn't the most common one. Health units don't always have a lot of control over the controls. They're not able to maybe recommend the engineering changes or say hand out respirators to a community. So a lot of the work that the health unit is doing is on this anticipation, recognition, and evaluation side. So the first thing I want you to notice about the slide is the extreme artistic talent of whoever put it together, because I think the Microsoft Word skills that are demonstrated here are pretty amazing. But the things that I really want to focus on, if I have access to the mouse, are the two differences, I would say very broadly speaking, in the exposure groups that we're looking at. And so the fellow on the left, in this example, it's near a chemical spill. You would sort of reasonably anticipate this person to be exposed to a much higher concentration of the substance that you're interested in this chemical spill. And you might also be concerned about multiple routes of exposure. And so in this case, you might be concerned about them breathing in the substance, about them ingesting the substance, or about the substance ending up on the skin. And so that's inhalation, dermal, or ingestion exposures. As you move further along to the right, there's two things that happen. And so first of all, the pathways, the contaminant that you might be worried about is going to be a lot more diluted. And so the concentrations that the people on the right are exposed to are lower. But the complicated element is that there are also more pathways where it can travel. And so you have the air medium, you have things that can migrate through the soil or even through the waterways. And when you look at residential or community exposures, you might be looking at lower concentrations, but then also you have to really consider the substance that you're looking at, because one or more substances might be what is of concern. And so outdoors, it might be an inhalation exposure. Indoors, there might be a groundwater, so an ingestion exposure. And in a basement, there might also be some vapor intrusion, which would cause inhalation hazards. So really just getting you thinking very broadly about the things that you might be looking for when you're concerned about a human exposure. Moving on, Sunil and I have already mentioned a couple times there's sort of occupational exposures and community exposures, and I just want to highlight a couple of the big differences when you're sort of going through those two. So in occupational settings, that's where occupational hygienists are traditionally trained. Often you're dealing with workplaces where there are sort of known or at least better known exposures, where the agents of concern tend to be a little bit maybe more concentrated or at least a lot easier to characterize. And so if you're working in a chemical plant, you typically know what chemicals are being used at the facility, and if you know the process, what chemicals might be getting into sort of worker exposure situations. And with that in mind, you have a very specific population of concern, which are the workers in this plant. For that reason, there are a lot of applicable standards that are legally enforceable through the Occupational Health and Safety Act. And so there is a lot of ground to stand on with regard to the levels that people are exposed to. When you get into community settings, you tend to have lower concentrations. And so there is a sort of comfort in the fact that the concentrations are lower, but there's also some ambiguity that's important to remember. And so one of the things is that lower concentrations tend to be harder to measure. And so occupational instruments have what is called a limit of detection, below which, if it's below this limit of detection, there might still be a concentration, but it's impossible to quantify. You don't know how low or how high it is below this level. And so that's something you can potentially encounter in community settings. The other thing to remember is that it's actually hard to attribute to a single source. So if you have very sensitive ears, you might be able to hear construction noise on the line. But if we were to take a measurement in the building about the ambient noise, it would be hard to blame that construction as the only noise source so far away. So there's always some things that you have to be thinking about when you're sort of measuring these smaller concentrations or measuring further away from a source. The other thing to remember is that you often have guidelines in places of standards, and so one would be sort of the Residential Health Canada guidelines for indoor air quality. These aren't necessarily legally enforceable. They're more of a sort of best practice or things that you might want to change if you have a level above this guideline. And so what you don't have is that sort of very clear legal definition of what an overexposure is. I will say, generally speaking, indoor measurements are always easier to take than outdoor ones. And this is pretty much, it just boils down to weather. And so you can intuitively sense that weather on a given day there might be rain, there might be sort of higher pollution levels. And that's really hard to control for when you're, say, worried about pollution from a single facility. And so generally speaking, indoor environments tend to have the same levels of humidity or ventilation from day to day, and it's easier to make a comparison in those environments. The final point that I'll make about community settings is that the health information is often absent. And so what I mean by that is where you might see an occupational study that's linking compound X to cancer or to a negative health outcome, it's a lot rarer to see compound X causes this effect in this community. And that's simply speaking, I have a lot of colleagues who do environmental epidemiology who would just talk about how expensive and how inconclusive those studies can often be, which means the bottom line is they're just rarer. And so if you're looking for that kind of information, you might be disappointed. So I've alluded to some of those things, but just bringing it back to health units, it is important to make the distinction between occupational and community exposures. I'm just going to highlight two examples here. And so one that we received is sort of interpreting a consultant's report. And so sometimes a consultant will refer to a standard and maybe an occupational exposure level, and it will be used in a report as a measure of safety. But then that's really still up to the health unit to determine whether or not that was an appropriate use of that standard. So keeping in mind that everything that I've talked about with occupational exposures, they tend to be higher concentrations, like they're a worker population where it's maybe a chronic exposure. And is that really an appropriate standard to use for communities? And you might find some cases where it is and some where it's not. And so we'll talk to that in some of our case studies. But the other example is community complaints. And so if you're being forwarded a health issue, community members, we're living in the internet age where people will often do their own research on a topic. And if people are sort of citing evidence, for example, that's in an occupational disease report, that again may not be an appropriate use of that information, and it might not be representative of the exposures that you would expect to see in the community. And so it's worth it to think about all of these things when you're provided with information, even before you think about sampling. I've done something here that I don't know. If I just open this again.
Oh yeah, that's
okay. So this is a bit of a rhetorical question because the reality of what we've done for health units in the past is actually none of those. Because the most common assessment that we typically support health units with are what we would call spot checks. And so when you think about what a spot check is, it's actually more of a walkthrough assessment where you're sort of identifying specific areas and testing for a very short period of time. So this is typically done with what we call a direct reading instrument. So that's an instrument that's providing sort of live data in real time, which I'll bring some examples up later. And it's really important because the spot check will actually mean different things depending on what kind of exposure question you're hoping to answer. So I just bring that up because it is important to sort of follow instructions or develop a protocol if you're going to go through with something like a walkthrough assessment. Typically these things are not compliance tests. You can make loose comparisons to a guideline, but generally speaking, they're not going to be sort of a legal standard. If you wanted to do that, you would have to do something a little bit more elaborate, and I'll bring that up a little bit later. I just want to highlight this point. Even with a spot check, it is really important to sort of put some thought into what you're looking for before you go out and start measuring, because you might end up with more questions than answers. So to highlight some of the pros, spot checks are generally pretty easy. They're quick and they can be done with fairly easy to use instruments. In some instances, they're useful as a screening tool to confirm the presence or the absence of a specific substance. They can be very useful as a source detection test. And so one frequent one that we come into is a formaldehyde exposure from a new piece of furniture. And so resins used in manufacturing processes typically have formaldehyde as a component, and this will off-gas if you have, say, a new piece of resin furniture. And that trend is sort of easy to see over time with that formaldehyde reducing. And so you can both sort of walk through and see formaldehyde as a source, if it is one, And then actually on repeat visits, you might be able to see that level going down over time if it is just that one source. Another time you might end up seeing something like a trend from a spot check is a vapor intrusion issue from a basement. And so if it was a spill that got cleaned up, what you would hopefully be seeing with repeat spot checks is that the levels in the basement were going down over time. So with that said, there are some serious limitations to doing a spot check. One of the big ones is that you might miss the worst case scenario. And so typically, especially when you're addressing health unit complaints, it's really important to try to find the thing that is being complained about in your assessment, because if you're not sort of confirming whether or not that complaint is an issue, there's limited utility to the assessment. So the question you really have to ask yourself is, if you don't find anything, is there really nothing, or is there something you might have missed in your protocol? Once again, you do need to know what you're looking for. And so if you go out, say, and look for the impact of smoke from a neighboring apartment building, if it's an infiltration issue of cigarette smoke, and you go out without a particulate matter meter, you're not going to find the smoke infiltration, you're not going to find the right issue. And so it's just important to know what you're looking for. It's also important to know how you're going to follow up and communicate that information to the parties who are complaining. And so if you don't have a sort of clear communication plan in place, then you might be struggling with a lot of interpretation. But the final thing to remember is that it's not a legally enforceable test. And so if you do find something that you're concerned about from doing a spot check, you are going to have to do more follow-up testing or design a more robust sampling plan. So this is just sort of a rehash of the first slide that I brought up with thinking about environmental exposures. And so I'm first going to follow you down through that pathway. And so very simply, when you have an environmental hazard, there's going to be a route of exposure, a potential population that gets exposed, a target tissue, so something in the body that gets affected by this hazard, an adverse effect, and then you have a clinical outcome. And it's really important to think about, what the effect of this exposure might actually be before you really get into a sampling exercise. And so some of the things very broadly that you can ask are, what are we worried about and what are we looking for? Where are people potentially being exposed and who is being exposed and for how long? So, I think that's all I'll say about sort of thinking about exposure questions. Now I'm just going to walk through some quick examples where PHO equipment has been used to investigate specific issues for some of our equipment. And so the first one I'll bring up is air quality issues. And so I'm going to speak more generally to air quality issues. And so I spoke about this a little bit already, but when you're sort of talking about complaint investigations, it is generally better to try to capture a worst case scenario. And so in that case of the cigarette smoke example, like if the neighbor isn't smoking at the time of your complaint investigation and the suspect or the complaint about exposure is not there, your assessment is not going to provide valuable information, and it might actually just anger the person who's complaining more. And so it is worthwhile to really get a sense of the timing of the issue and try to address timing as part of the exposure investigation. For that reason, if you're looking for something quick and easy, those sporadic type issues are not quick and easy. They require a lot more communication and timing to sort of build up how you might go and do an investigation. For that reason, it's a lot easier to do investigations when the issue is sort of stable or a little bit more persistent. And so if there's sort of a mold or a moisture issue indoors, if there are complaints about inadequate ventilation sort of affecting general health, addressing odor complaints is sort of on the line based on what I've said, and ice arenas where you have sort of a known contaminant in an enclosed environment, which Sano will be speaking to after I'm done. I'm not going to go through the instruments that we have in detail, but suffice to say we have a lot of fairly easy to use indoor air quality monitoring equipment. And so some of the measurements that we have very broadly are more about either parameters, so velocity, temperature, and humidity, and then also sort of more, oh, I've done something again. So so we have instruments that do environmental sort of more parameters like velocity, temperature, or humidity. And then we have more sort of chemical measurements, which would be particulates and gases. Another one that's come up in the past has been noise complaints. And so the example that was very easy to respond to was fan noise that was happening in an HVAC system in a neighboring apartment building. And so the reason why that was easy is because an HVAC is a fairly persistent and relatively stable noise source. When you're talking about noisy neighbors or maybe loudness from a concert venue, you do have to think a lot more about the timing of when you might be going out to do this assessment. So the fan noise was an easy one because a spot check in this case, if you did about a 15-minute sample close to the HVAC and then sort of were able to move away and see the impact of that source, you could get some very valuable information. From the other situations I described, it can be a little bit trickier. And so I won't go through too many of the details of this instrument, but suffice to say it's a pretty easy instrument to use. It doesn't capture, it doesn't record the sound in the area, which is often a confusion people make, and so people are worried about being recorded when a noise investigation is taking place. This just records the amount of sound in decibels and sort of does some calculations about the frequency of those sounds. It's not, you don't have to go back and listen to the recordings, and so that's easier for sure. Anyway, and so the final one that I'm going to talk about before I pass it off to Sunil is complaints about dust from local industrial activity. And so this is again sort of on the fence about how beneficial a spot check can be. And that's because dust events in these issues can be pretty sporadic, and so it can actually get pretty difficult to investigate from a spot check alone. If you're going to do this type of assessment, you would have to have a good sense of the timing. And so, for example, an upwind and a downwind sample can be used as a comparison source. And so what I mean by that is if you place an instrument upwind and then an instrument downwind, what you would hope to see when the wind passes through is that a dusty facility would be showing much higher levels on the downwind sample. And so that type of information can be quite useful in seeing the impact of an individual facility. With that said, there are a lot of moving parts in that type of an assessment. And so when we've done these dust assessments in the past, we typically leave an instrument in place for a short period of time. By short period, I mean 3 days to 2 weeks. And we place another instrument at a reference site and then see how the levels compare between those two. And so this is the instrument that we do use to do those kind of dust assessments, and so it's the DustTrack DRX. Beyond spot checks, longer samples tend to provide a lot more information, but then you do have to spend a little bit more time thinking actively about how you're going to develop a sampling plan. For example, you could take samples from pumps that are going to be sent away to labs. So that kind of information isn't going to provide trend data, which is provided by direct reading instruments that sort of show you the up and down levels, but it is going to give you a very reliable piece of information about the concentration, especially over longer averages. And when I mean longer averages, say like an 8-hour exposure that might actually be a better representative exposure, a better representation of exposures as they are experienced, say, by residents. And so 8 hours is better than 2 minutes in terms of representation. If you're looking into doing something longer than a spot check, the EOH team can assist you with gathering data if you're choosing to do it yourself. If it's too onerous and there's a budget involved, we can also help to develop a list of need-to-knows, as I would call them, if a consultant is going to be brought in to answer more in-depth exposure questions. And we can also help with interpreting the data that gets generated in those reports. The other thing that we can help that I think is coming up more is interpretation of citizen science. And so these instruments typically are getting cheaper and cheaper. And so in terms of sticking something into a phone and being able to get something that is going to give you some sort of data, that type of instrument is more and more available in the consumer market. If you're receiving sort of reports that are using this consumer information, it is sort of useful to learn about the specs of the instrument, because it might, and by specs I mean specifications, and sort of the ability of it to actually capture the substance of interest, because that is extremely variable with consumer devices. I'm not going to talk too much about the pumps that we use, but this is going to come up in one of the case studies. And so this is just the personal sampling pump that is sort of the industry standard for occupational hygienists to take air samples. So obviously that was not a complete list of all of the instruments that PHO has available for loan through our equipment loan program. And so I encourage anyone who's interested to go check out the link that I've provided here and see what other instruments are available. And so with that said, we're going to move on to case studies, and I'm going to pass it back to Sunil.
Thanks, James. So the first case study I'm going to talk about is indoor air quality at ice arenas. So requests for environmental monitoring equipment for IAQ surveys at ice arenas are one of the most common that we receive. EOH has a variety of IAQ monitors suitable for ice arenas or other IAQ scenarios. So for anticipation, resurfacing equipment used at ice arenas are often powered by natural gas, propane, or gasoline, which produce combustion byproducts. Under some circumstances, these combustion byproducts can lead to indoor air quality problems. Indoor air quality at ice arenas should be investigated, as there is the potential for the public to be exposed while inside ice arenas. So for recognition, nitrogen dioxide, NO2, and carbon monoxide, CO, are combustion byproducts that are produced by natural gas, propane, or gasoline-powered resurfacing equipment. And under certain conditions, NO2 and CO can build up within an arena. NO2 is a respiratory irritant. CO interferes with oxygen uptake, and those with coronary artery disease are more susceptible to carbon monoxide. At sufficiently high levels, NO2 and CO can result in adverse health effects. So for evaluating indoor air quality at ice arenas involves measuring levels of NO2 and CO in the arena before, during, and after resurfacing activities. So we want to get an idea of the change in these levels of NO2 and CO after the equipment's been run. And EOH has multi-ray toxic gas monitors, which are a type of direct reading instrument that can record levels of NO2 and CO over time and can be used to evaluate exposures in an arena. Health units have found the multi-rays easy to use in practice, and these have been sent out several times to health units, to different health units for conducting ice arena audits. So for control, some causes of elevated levels of NO2 and CO within arenas include infrequent maintenance or older resurfacing equipment, insufficient operation or design of the ventilation system, mechanical breakdown of emissions control equipment on resurfacers, or breakdown of the ventilation system. And control is basically focused on fixing the causative factors. And so one control could be replacing natural gas, propane, or gasoline-powered resurfacers with electric-powered units that would not emit NO2 or CO. And so this eliminates the source of the pollutants. This can be a pricey control. Some other controls could include regular emissions testing and adjustments for the resurfacer that the arena has, improving the ventilation system or increased use of ventilation. And this, again, the controls go back to what the causes are, what the causative factors are for elevated levels of NO2 and CO when we see them. And I'm going to pass it back to James for the next case.
So this is going to be our final case study, and this is an example of a response that we did a couple of years ago at an indoor firing range. So for background, this is a little bit more of a complex response, but it does sort of showcase, I think, the level of complexity that we're able to get to. And so in this particular instance, there was one individual in a rural health unit who had an elevated blood lead level, which led to the notification of the local public health unit of the issue. And so this individual had also reported shooting twice weekly at an indoor firing range. So following the recommendations from the EOH medical staff, the hygienist on the team conducted a lead exposure assessment of the firing range. So just thinking about lead as more generally as an exposure, for context, both bullets and gunpowder are known to contain lead, and so when you're using bullets in a firing context, the dust exposure and the smoke is a main concern. And so that dust can actually get everywhere and is a big problem for actually cleaning up. And so in addition to doing sort of air sampling during the firing exercises, we also recommended that surface samples be taken to sort of characterize the area. So when we were going out and doing this assessment, we did want to identify key areas of concern for lead exposure and the distribution of lead in the facility. We wanted to also look at the adequacy of the controls that were being used in terms of both their ability to limit the lead exposure for people who were firing guns, and then also what steps they were taking to prevent take-home lead exposure. And so by that I mean the dust from the bullets or from the firing activity that would settle on your clothes or on your hands. I'm going to assume we have a technical issue again. Sorry. That's okay. And so, yeah, as I said, we wanted to sort of limit the exposure both during the firing exercise and that take-home lead. And where possible, we wanted to make recommendations for improvement. So the types of instrumentation that we used was a little bit different than what I've talked about before. The three that I'll talk to are the wipes that we use to assess hand contamination, and then also wipes to assess hard surface contamination, and then also vacuum samples for soft surfaces like carpets. And so really when you think about it, this is still a spot check. It was just a one-off measurement in an area of the dust or of the contamination on the hands. And so this does have a lot of potential to sort of profile the environment to which people are exposed. but it doesn't really tell you anything about the lived exposure or anything that people are going to be breathing in during their exercise. And so for that reason, we also had to do area monitoring with those pumps that I described earlier. And so two types of samples were taken, personal breathing zones of the shooters using a sampling pump that was drawing air onto a cartridge, and then also with those same pumps, area samples both in the firing range and then outdoors of that facility where there was a kitchen and sort of a living room facility in this same building. So what we found was interesting because it was valuable information from both parts of the assessment. And so from the personal monitoring activity, we did find that the occupational exposure limit was exceeded during the short-term firing activities, and the ventilation that was being used on site was inadequate to clear the lead dust from the air. The reason I thought this one was an interesting example is because we used the occupational exposure limit as our reference value, and we saw it as suitable in this situation because this was a hobby activity where people were exposing themselves to what would otherwise be an occupational level of risk. And so in that case, we saw it fit, and there wasn't necessarily a sensitive group like children under 6 doing, well, I hope not, shooting these guns. I hope did we ask that question? We didn't ask that question. We assumed it was clear. So, but suffice to say, this was a situation where an occupational value is actually useful. There would be others where it's not. But then lastly, the spot checks also provided helpful information about the controls. And so when we did these tests, lead was actually present on all of the surfaces, including the kitchen and the main table areas, even though in those kitchen and main table areas, the concentrations were much lower than the concentrations in the gun range. And so what we did sort of have is a valuable characterization of where the contamination was happening in the facility. The other thing that was really great from the spot checks of the hands was that after a firing exercise, people did have lead contamination on their hands. And so we were able to provide some guidance on hand washing and then some looser sort of control advice about wearing different clothes to do this activity, because you really don't want to be wearing the jacket, say, that you were shooting in home and then leaving it on your floor at your house. It should be a contained exercise. And often when you're looking at sort of applying controls to a community setting, you're never going to have the ability to sort of recommend $1,000 upgrades to a facility. It's going to always end up being more of the perhaps administrative controls that Sunil talked about earlier that are going to maybe be, and administrative controls are really sort of the traditional public health advice, sort of changing your behaviors to avoid an exposure. And so it's worth thinking about how you might apply those to new situations. So that concludes our case study, and so I just wanted to recap and summarize everything that we've gone through in this talk. And so we started by describing the basic elements of occupational and environmental hygiene, including the anticipation, recognition, evaluation, and control of health hazards. We wanted you to know how to access the EOH Instrument Loan Program. We wanted to explain some different approaches to sampling and how sampling might be used to answer exposure questions, and then also some of the strengths and weaknesses of those methods. And then we described some examples where sampling equipment can help with hazard investigations in communities. So that concludes our presentation, and Sunil and I are available now for questions.
Thank you very much, James and Sunil, for an excellent presentation, and I'm going to say a very applicable and relevant presentation. Oh, sure. Okay. So first of all, I want to take this opportunity to apologize. I understand we did have some technical issues during the presentation. I'm hoping we didn't lose too many people, but thank you for your patience with that. I know the organizers here go to extreme pains to ensure that technical issues don't arise, but unfortunately, doesn't always cooperate. But let me say, first of all, while we're getting set up here, James and Sunil, that it becomes evident very early on in your presentation that we are very fortunate here in Ontario to have Public Health Ontario and the expertise that you have, of course, in monitoring and interpreting data. And I know that it's very helpful for public health inspectors and other environmental public health professionals to have you at their disposal. More and more our members at Sci-Fi are dealing with more involved and technical cases in various areas, so it's very helpful. So at this time we do have about 15 minutes for questions, and what I'll do is I'll, I suppose, alternate between the webinar and questions in the room. Do we have any questions in the room at this point? Okay, so why don't you, while you think about that, we'll go to the first question, and let's see here. Well, I guess everybody's seeing what I'm seeing. Oh, okay. So do we have any questions online or in the room? Ray Coates.
Thanks, Sunil, James. Great presentation. Could you say a little bit about some of the sort of training or in-service work that you've done to help folks in health units get better acquainted with the instruments and kind of feel comfortable using it where appropriate?
I'm just going to err on the side of caution and ask that you repeat the question just before you answer it. So, thanks.
Okay, so the question was, can you comment about in-service training to health units to assist with operation of the instruments? And so we've done workshops with health units, and it's been on site we've visited health units. People have also come to Toronto for training on the instruments, and it's just one part of the process as as you go forward with, if you go forward on a given scenario that you want to do measurements, we provide training, and the instruments generally are pretty easy to use, and we also at times go out into the field for the initial measurements. We accompany the health unit staff as well as things get started. If it's a more extensive exposure monitoring that we do, we'll be out for the first few days, sometimes even longer than that. Yeah.
Okay. Were there any other questions, either online or in the room? We do have a question online, and are there instructions that come with the equipment?
So there are generally instructions that come with the equipment. If it's one that is being sent out regularly and is fairly easy to use, we would typically just send out an instruction sheet. If it's more complex, that is when we might provide some additional training, either by phone or in person if necessary, about how to operate an individual instrument. And so it's not a catch-all statement, but generally speaking, we do have sheets, yes.
So we do have a guest from Grey Bruce Health Unit with another question.
I'm just going to add, sure. I'm just going to add something to that last question. So sometimes things come up where a health unit is taking measurements in the field and a problem pops up or an error pops up with the instrument, and they've been able to call us, and we're usually able to troubleshoot even over the phone, and if not, we're able to often go out as well to fix whatever problem comes up while taking measurements.
My apologies, Sunil. Thanks for adding that. So we have a guest from Grey Bruce Health Unit who's asking, can you tell us what the turnaround time is for equipment loan in a given situation? I imagine it may vary depending on the needs, but I'll let you guys answer that.
So generally speaking, we can do short turnaround, but this is where we ask you to pay special attention to the anticipation of occupational hazards. And so if you're looking for a one-day instrument or sort of putting out a fire, it's going to be a lot more stressful for us to try to get an instrument to you on that sort of short time period. And so generally speaking, I guess we can do about a 1 or 2 day turnaround, especially for ground shipping, but a week's notice is always appreciated.
Any other questions? Oh, we have one from Brian Rawson from Peel Public Health. Is there a charge for PHO services to provide advice on working with consultants and collecting environmental measurements?
Yeah, so there's no charge for the use of the equipment or for us to provide expertise on using consulting services. There are instances where you're taking measurements with pumps, and those the sampling media would need to be sent to a lab, so this would be considered expendables. And in these situations, the health unit would be expected to cover the cost of the expendables and lab analysis, but many of our instruments that we ship out don't require expendables and are available free of charge.
And just to add to that, we wouldn't ever sort of recommend a specific consultant. And so in terms of the cost, we would only provide what you would be hoping to get out of an individual report and not a recommendation about who to use, for example.
Great, thank you. And this, of course, speaks to the value that I mentioned about having PHO at our disposal to have this level of expertise and advice free of charge. So, are there any other questions either online or in the room? Yes.
Can you give us an example where you mentioned that there are circumstances where perhaps sampling or taking a direct measurement is not preferred? And can you give us a specific example, perhaps you've run into at a health unit where that's happened?
Yeah, so the question was more alluding to, we did mention in the presentation that there are situations where sampling might not be a go-forward strategy. And so we did think about this a little bit, and one example that comes to mind would be, say, complaints about residential wood burning. And so in a situation, we've been contacted in the past from separate health units about residential wood burning complaints causing sort of nuisance smokes or odors for adjacent properties. And so most of the time, after sort of going through the logistics of the assessment, the health unit has opted not to do these measurements. And so it's not only because of the logistical question about investigating when the smoke is happening while the burning is happening, but also to some extent the outrage management that's happening beside that issue. And so when you're dealing with maybe two arguing neighbors, getting in there with an instrument and sort of getting a robust technical assessment probably isn't going to answer the question as well as you would like, and it's probably going to make a lot of people angry. So it's good to think about maybe just the human factors involved in some of these assessments. And so that has been one big example where sometimes sampling is not the answer.
I'm glad you touched on that, because many times I'm going to assume that you get involved in cases where health units are dealing with really contentious issues, perhaps political issues or driven by great media interests. So I guess you didn't speak a lot about, outrage management, and I know it's something that our public health inspectors have to deal with on a daily basis. That's definitely something that comes to mind when we're dealing with this type of scenario. Any other questions in the room? Yes.
What are the most popular instruments?
What are the most popular instruments?
So probably the most popular instruments are the ones we use for indoor air quality. The multi-ray has been a popular one. The dust track for particulate matter, that's also used quite a bit by health units. We've used Zanarda a fair bit. That's a device that measures radio frequencies. So this is in relation to cell towers and Wi-Fi. The port account as well. So this is an exposure monitoring device. The port accounts for respirator fit testing for health unit staff. We have two of them that we loan out to health units to conduct fit testing on N95 respirators. And so these both are in frequent use. So I
noticed too, Sunil, on some of the slides you had the PHO van. pictures of the PHO van. Of course, that was, we always love seeing that driving through the streets, right? But of course, we've utilized your assistance at Toronto Public Health on concrete batching issue that we were dealing with. Do you use the PHO van often, and what sort of applications would you use that in?
Yeah, so the PHO van is a combination of equipment shuttle and stationary monitoring enclosure, I guess is what we would call it. And so we can stick a lot of different environmental monitors into the van and do longer term assessments. Typically, we use dust tracks and then some more robust Environmental Protection Agency rated equipment to monitor for usually traffic-related pollutants. So I won't get into too much detail about it, but it's good to go, especially if you're less than a 2-hour drive, I would say.
I won't ask who gets to drive the van, but are there any other questions in the room? Yes?
Thank you. You really emphasized, I think, some of the responsive uses of the instrumentation. Can you make any comment about its use in surveillance or mapping things like community noise, or perhaps, evaluating sites where, a school or other public facility might be located relative to things like, say, traffic? So the sort of proactive or surveillance community mapping uses versus response.
Yeah, so we're always actively, so the question was more if we could speak to the more surveillance-related activities with the equipment available at the EOH Loan Program. And so in the past, we have done a number of different longer-term studies with, for example, our noise meters. And so we did a Toronto-wide community noise survey. And that methodology was promoted, I think, previously at one of the Ontario Public Health conferences as potentially deployable to other health units. So we are always interested in longer-term monitoring activities. We've also, at the request of one health unit, started to get into more traffic-related air pollution monitoring. And so if you're interested in taking on sort of a more I would say long-term or sort of anticipatory sampling exercise, then definitely get in touch with us because we can help you with that. So.
Lots of great questions. Are there any more? I'm not seeing any more hands in the room, and no more online. Doesn't seem like, but thank you very much. And let me take this opportunity. I hope I'm not putting words in your mouth, but just to encourage everyone who is on the webinar and maybe tuning into this to take advantage and avail yourselves of the services that are provided by Public Health Ontario. I think my first interaction with them, I was definitely intimidated, and I wasn't sure if my issue was really big enough to bring to Public Health Ontario, but I could tell you they're very receptive and they're very open to hearing what your concerns are. And even if it's not a field measurement that they come out to do, but sometimes a simple phone call and just some brief consultation is just what you need to move you forward in your investigation. So I encourage you to contact Public Health Ontario for those reasons. I would like to thank everyone on the webinar who joined us today, and everybody in the room for the Sci-Fi Ontario seminar series. It is great to have this participation on a monthly basis, and I would like to note that we will not be having our October webinar due to our Ontario Sci-Fi Conference, which is being held in Peel Region between October 1st to 4th. So we hope to see many of you out there, and please ensure that you take the time to complete the evaluation at the end of this session. I understand evaluation forms are available. And I'd also ask that you take the information from today and reflect upon it and how this information provided in the session can be used in your current work setting. So with that, I'll